Hello friends, I am Dr. Sunil Garg and in this video I will be discussing about non-invasive ventilation in acute respiratory failure. I will discuss when and when not NIV should be used, its contraindication and complication of this modality. So let's learn about NIV. So what is NIV? NIV is delivery of positive pressure ventilation which is delivered by connecting ventilator to a patient without a endotracheal tube or tracheal tube but through various non-invasive devices, and these devices includes nasal mask, nasal plugs, oronasal mask, full face mask or helmet devices. It is a common belief if patient has hypoxia before intubation and invasive mechanical ventilation, patient can be given a trial of NIV, which is not true. The judicious use of NIV requires understanding of its proper indication. The condition where NIV is likely to be effective include patients with hypoxemic respiratory failure due to cardiogenic pulmonary edema and patients with acute hypercapnic respiratory failure due to acute exacerbations of COPD. Not all patients who meet the indication can be successfully managed with NIV. The potential indicators of success with NIV include younger age of patient, less acuity of illness, better mental status, less air leak, ability of patient to cooperate, and when patient's clinical condition and gas exchange improvement occurs within first 2 hours of its application. These are by no means hard criteria but provide reasonable value to predict potential for success of NIV. Now coming to contraindication, it can be divided into absolute contraindication and relative contraindications. Absolute contraindication includes if patient is in the cardiac and the respiratory arrest, or if patient is in severe respiratory distress, as such patients are not able to tolerate or not able to cooperate with NIV, and if patient is with the unstable cardiac arrhythmia. Relative contraindication include patients with GCS less than 10, upper GI bleeding or recent upper GI surgery, hemodynamic instability, facial or neurological surgery, trauma or deformity, inability to cooperate, significant upper airway obstruction or not able to protect upper airway, or insufficient staffing in the unit. What are the risks of invasive mechanical ventilation becomes the benefit of non-invasive ventilation. As there is no invasive device, so less incidence of nosocomial infections and barotrauma is rare, leading to shorter length of ICU or hospital stay. Disadvantages of NIV include poor tolerance in awake patients, and due to air leak, ventilation with NIV may be less effective and it should not be used for prolonged periods in acute setting. Complications of NIV are few and minor one, and it is mainly due to interface. It includes gastric distension leading to aspiration, nasal dryness, air leak, local irritation or ulceration over face, particularly nasal bridge. Not all patients respond to NIV adequately. Few disease conditions are less likely to respond to NIV, and these conditions include patients with acute hypoxemic, non-hypercapnic acute respiratory failure due to causes other than acute cardiogenic pulmonary edema. For example, patients with severe pneumonia. Another category include patients with acute respiratory failure due to asthma exacerbations and patients after extubation who develops acute respiratory failure, or patients with postoperative or chest trauma related acute respiratory failure. Other indications of NIV include for oxygenation during intubation in hypoxic patients, and it may be helpful to relieve dyspnea during palliation. Thanks for watching this video. If you have any feedback, suggestion, comments or any question, please write in the comment section box. In next video, I will discuss further about NIV. Once again, thanks for watching this video.